Alright, so we're looking at bacterial vaginosis, or you could say bacterial vaginitis panel, or you could say the bacterial vaginosis panel. Alright, so to my understanding of the panel is more of like you are trying to access what actually caused the disease condition. Okay, because you can actually have a lot of causes of these things, so you're actually trying to look at what caused the disease condition and like the stage of the disease condition also. So for the bacterial vaginosis panel, we said that it's a diagnostic test. So it's designed to identify common causes of vaginal infections, like I was telling you guys, right? So you have an issue of bacterial vaginosis. So you're trying to like identify like what has possibly caused these issues. You understand? So you're trying to identify the cause, right? So what it dictates for bacterial vaginosis, it dictates organisms like Gardnerella vaginalis. You can see the Gardnerella is not even here, okay? So it's supposed to be here. Okay, well, they put a section for bacterial vaginosis. So under the bacterial vaginosis, if you see a comprehensive picture of this, the Gardnerella vaginalis should be included there, okay? And other anaerobic bacteria. So for vaginal candidiasis, you are now looking at all those candida albicans and is it gallbrata or something, okay, that usually causes what? The candidiasis, that's yeast infection for vagina, okay? So you can as well have it there under the candida species. Then trichomoniasis, of course, you are talking about the Trichomonas vaginalis, which causes the trichomoniasis. So bacterial vaginosis and vaginitis panel is like a diagnostic tool. So it will help to identify what actually causes it, okay? So how the test works is a vaginal swab is collected, okay? Of course, you want to test for an issue from the vagina, so you have to like get a swab, like you have to like get your sample from there. So the sample is now placed in a specialized transport system, okay? Now the test usually uses DNA. You have to identify, DNA of an organism won't lie, okay? So these tests rely on highly specific DNA so that it can be able to, identify the true cause of a vaginal infection. So when is it ordered? When vaginal discharges are foul-smelling or unusual, when there's itching, irritation, or burning, when the woman is having pain when she's urinating or having an intercourse. So a healthcare provider or a gynecologist can actually perform it in a clinic or even in your house, okay? So that's it for what this panel actually means.